Welcome back, everyone. Thank you for staying with us through this long day, but we've saved definitely the best for last here. It's my honor to introduce Dr. Vandana Dua Niyar, who I think I've met at KidneyCon for the first time a couple years ago and was very happy to be a part of the NSMC internship with her. She was our, I think, most senior member of the internship, was a professor of medicine at the time, still is. And really had a great time getting to know her and really looking forward to the talk. So a little bit more of an introduction. As I mentioned, she's a professor of medicine in the Division of Nephrology at Emory University. Her clinical interests center on kidney injury with specific expertise in dealing with vascular access for hemodialysis patients and kidney ultrasound. She's passionate about promoting multidisciplinary collaboration in research and education in the field of vascular access, with the ultimate goal of optimizing access care and processes for dialysis patients. She has several leadership roles, including currently she is president-elect of the American Society of Diagnostic and International Nephrology, and she recently graduated as a fellow of the Woodruff Leadership Academy. She enjoys teaching and has taught numerous didactic presentations and hands-on training workshops regionally, nationally, and internationally. She has served as co-chair of the ASDIN 2018 and 19 annual scientific meetings, co-chair of the 2018 and 19 ASN and ASDIN ultrasound workshops, and co-chair of the 2019 NKF hands-on vascular access course, and of course our KidneyCon ultrasound workshops also. She's authored numerous manuscripts and is a regular reviewer for multiple nephrology journals. In 2019, Dr. Niyar received the ASDIN Distinguished Service Award for her contributions to the field of dialysis access, and the Emory Department of Medicine Nanette Wenger Service Award for implementing protocols for vascular access preservation for patients with chronic kidney disease. And most recently, she was the recipient of the American Society of Nephrology Mid-Career Distinguished Clinical Service Award. Despite all that, she's one of the most humble, accomplished people that I have met in this field. Very inspiring for me personally. So thank you for joining us, and can't wait for your talk.
Thank you. Thank you, Samira. So can I share my screen, Samira?
Yes, go ahead.
It says I can't share it while you're sharing it.
Try now.
Can you guys see it now?
I don't see it now. Oh, yep. Yes.
Okay.
Looks great.
Perfect. So good evening, everyone. Thank you very much. It's such an honor to be invited to give the keynote at KidneyCon, because KidneyCon is really one of my favorite conferences. It's the perfect mix of education, learning, and fun. And I've made so many new friends here, and got my old friendships, worked on them, and the camaraderie is amazing. I've learned so much here, and the biggest draw, of course, is Dr. Arthur's and Kathy's hospitality in hosting the Triple M. But to be honest, this is one of the hardest talks that I've ever given. And I'm used to giving content talks where, it's all about very objective scientific presentations. And it's very hard to share my personal journey and everything else. But I hope as you walk through this, I'm really glad that I got this opportunity, because in the general scheme of life, we're just actually moving forward and not really reflecting on what's going on within our lives. And so it was a good moment for me to be actually able to look back and think back and see what it is that I've done, what am I doing, where am I going with all of this. And of course, hindsight is 2020. So I will say that one caveat is that everything I share with you, I was not necessarily intentional at that time. Things happened, things changed, and I moved with the flow. And so what I've tried to do over the next 45, 50 minutes or so is to discuss my journey with you, to be able to share, what I've gone through, and maybe pick up some pearls that you don't have to reinvent the wheel for that, and go from there. So here, I'm going to talk a little bit about my initial journey. And so I was born in India. My dad's a doctor in the Indian Army, and my mom is a teacher. So it was natural that I would combine both their strengths and become a clinician educator. And as we were in the army, we traveled all over India and the world. So this map really just shows the places that I had been to before I was 14. And over the years of schooling, I went to 10 different schools. And I feel that this early period really defined me because this exposure I got to the world, the diversity, the acceptance that change is inevitable. And that's, it's part of life, has helped me adapt to any situation and be comfortable with whatever life has thrown at me. And when I, came back to India, I was able to join medical school at the age of 17. And I was really fortunate after that to be able to continue my education and start my residency in internal medicine. And at that time, this is the time when I got in touch with that was my first brush with nephrology. This is my mentor, Lieutenant General Narula, who was also my guide, my advisor, my thesis advisor as well, and my clinical lead. And it was under his tutelage that I really learned everything that I started to know about nephrology. As part of being an intern and a resident, I was responsible for the whole board. And I did, under him, under his supervision, I learned how to do blind kidney biopsies. I learned how to, put the Wimselmamel needle in. And it was when you knew that it was moving back and forth with respiration that you knew you were in the kidney. We placed acute PD catheters at the bedside and in patients because we were working with limited resources at the time. And so this was, my first foray into nephrology. I really loved it. As part of my graduation, I had to do research. And the research that I did with him was prognostic factors in acute renal failure. And we were very, very fortunate that it was recognized by the ICMR, which is the Indian Council of Medical Research, which is the counterpart of the NIH in India. And we were funded for that. And I really thought that's what my life was going to be like. I was going to be an academic nephrologist in India, but life had other plans for me. And but now that we are on the subject of mentors, I think the first lesson that I've learned in my life is that you really need to, it really takes a village. You need to surround yourself with the best of the best if you can, and learn from their wisdom, because all the people here. So initially, when I was putting up this slide, I was going to talk about every one of them and what their influence has been in my life. But I don't have the time to do that because that would really literally fill a day. But all of these people have been very, very instrumental in my life. And I have learned so much from them that I wouldn't be where I am today without the support and the encouragement of all of them and many, many more. And, I first met Dr. Arthur, as he mentioned this morning, when I was presenting my research as a fellow. And I still remember the words of encouragement when he talked to me about my research. And for a mentor, sometimes, you don't realize what a few words of support and encouragement mean to a young trainee starting out. But to them, those kind words give you the strength to go ahead, to continue on, and to persevere. And same for us, when we get to that stage, when you get to be a mentor, I think that is the lesson for me. If I have to pick one, I'll just pick this one, is that you have to create the ripples of change. You have to pay it forward. So if there's one thing I can't say no to, it's my mentees. And I'm so fortunate to be able to pay it forward in so many different ways. And thank you, Samira, for the NEFSIM, because that's an amazing opportunity, and being able to mentor the medical students. And throughout, like, we have medical students, we have residents, we have fellows, we have other nephrologists. I'm involved in the Department of Medicine mentoring. I'm involved in the divisional mentoring, writing letters for support, for promotions, for awards. And I think the biggest thing that I've learned from everyone, from all these mentors, is that they make time for their mentees. And I got that in the early parts of my career. And I hope that I'm paying it forward as well. And I'm always learning from Dr. Arthur as well, from their meatballs mentoring and the martini meatballs and mentoring party that he always has. And I actually tried to emulate his footsteps. I couldn't call all the people at Asden, but the entire faculty. I did invite them to my house when Asden was in Atlanta. So just following in those footsteps and trying to pay it forward in any which way that you can. And then the other thing that I would say is we all have to start somewhere. So, I was sort of established, or I thought I was established in India, and that's where I was going to be. That was really my worldview at that time. I had traveled so much. I thought, we are settling down in India, but that didn't happen. And we all have to start somewhere. But the other thing that I would really say is that it has the foundation. Your foundation has to be extremely strong. So whatever you do to be able to get to the point where you need to be, the key thing is that you have to have a good grasp of your subject, so that whenever anybody turns around and they look at you, if they have a question in your area of expertise, they should think of you directly. You should be the one that people should be coming to for asking questions. Ideally, it should be your passion. And because if you find your passion and you're able to align it with your interest and give it 100% of who you are, you will definitely be able to get to the top of your field. And there's really no substitute for hard work. There are things that you have to do. You really as I was going through my life and going through my career, that was also the time that my family was growing, and I had to set out intentional time. For me, it was the time between 10, I know it's not looked upon as that balance, but something has to give. So I would work from 10 p.m. to 2 a.m. on the things that I was really passionate about. Because if you're passionate about it, it doesn't feel like work. And you can give it your best and you can give it your all. And that's the one way that I think that we can move forward. But in life, as in football, you won't really go far unless you know where the goalposts are. So it's very critical, especially in academic medicine, to be able to define your goals. What it is that you have a passion, you are interested in something. How can you combine or align the expectations of the university where you are, or if you're in private practice, of your practice, to see that you can come together? So until you know what are the expectations from you, you really can't achieve them. And I would say here that the most important thing, that most academic places will have this trinity of scholarship, service, and education. In some way or form, there'll be a combination thereof. And what you really have to do is try to excel in at least one of these fields, if not more, and be outstanding. And so have a move from an institutional to a regional, to a national, to an international reputation. And these are, for most academic places, these are very, very clearly defined, and you do have to get involved. So when you look at committees, a lot of people ask, well, what kind of committee should I be serving on? So I think it's very important, again, like I said, to find your passion, because if you're just on a committee for the sake of being on it, you're not going to be able to accomplish much. And when I first started, the first committee that, this is, a true story, the first committee that I was on was a committee where the goal of the committee was to decide the name of the Department of Medicine. So we would spend 1 hour every month discussing whether it should be Department of Medicine, Department of Internal Medicine, just internal medicine. And you can imagine that that was something that I was not interested in. So really, I didn't contribute much. I kept thinking to myself during those meetings, what am I doing here? Am I just on the committee for the sake of being on one? And I went back to my division chief and I said, I really feel like I'm not really offering anything. Probably someone who has an interest in this would be better off, but I'm more interested in working on decreasing central line associated bloodstream infections. So could I be on the CLABSI committee. So if you kind of figure out what it is you want, you can go to your mentors and try to figure out how it is that you can get involved. And as you get into the committee, as you're a member and you're productive, slowly you get to the point where you start leading the committees. And then if you're combining your service and your education, you're putting together conferences, you're organizing them, you're moderator, and ultimately you end up, organizing your own scientific committees and be able to give your vision to the organization that you're working with. So let's talk a little bit about another lesson that I've learned is stepping outside your comfort zone. So all of us really get very comfortable where we are, and we hesitate to step out of where we go. So the one of this study, the things that happened to me is when I was first starting out, I was very, very junior in my time. I had just done interventional nephrology for 1 year. And I was asked to give a talk at a national meeting on a necklace graft. So a necklace graft is a graft that goes across the chest. It goes from the axillary artery on one side to the axillary vein on the contralateral side. And it is not very common. I had literally seen one case of that before I was asked to give the talk. And my first instinct was to say no. And I went to my interventional nephrology mentor, Dr. Work, who really taught me everything I need to know about procedures. And I said to him that I have this invitation, but this is not something that I'm very comfortable with. And he was like, you've seen one case. Many people haven't even seen that one case. So go ahead and read everything you can about it. You'll be fine. Don't decline the invitation. So I did go ahead and take them up on it. I will say that if there was anything written about a necklace graft, I read it. It was whatever there was out there in the literature. I practiced my presentation multiple times, went up and gave the talk, and the talk was quite well received. And after the talk, the editor for our official journal for ASDEN, Seminars in Dialysis, was in the audience. And he came up to me and said that was an excellent review. And since you've already done the work, why don't you go ahead and write on it? And if you write it up, I'll publish it. So I took him up on that offer, and that first talk turned out to be my first publication. And there are many other different ways to get your publications as well. So if you see something that's a problem and you try to fix it, you can actually do a quality improvement project wherever you are. So what we had noticed at Emory was that we were seeing a lot of central venous catheter infections. And we are very fortunate. CDC is right down the street from us. And I had joined the CDC collaborative. And in one of the meetings, they talked about exit site infections and chlorhexidine impregnated dressings affecting catheter-related bacteremia. And I was very impressed with the data. And I came back to Emory and I said, I think all our patients should be getting chlorhexidine impregnated dressings. And Emory being Emory, and it's, you need data to support whatever you want to say. I went ahead and they said, well, show us that it works. But they did allow me to do this quality improvement project. We had 3 dialysis units at the time. We gathered baseline infection data on all our 3 units. And then in one of them, we started doing this project. We did it for 6 months. And then when we looked at the data, it was very impressive. I still remember the biostatistician when he analyzed the data, he was like, this is a great, whatever intervention you're doing, it's really working. And so once we did that, we were able to bring it up and discuss it with the other colleagues and everyone at Emory, even though the cost of the chlorhexidine dressings was higher than the cost of the regular dressings, we felt like the cost, it was worth it for our patients to be able to incorporate that within our dialysis units. And so we went ahead and did a test of change in all 3 units. And now everyone at Emory Dialysis, this is the standard of care. So I think that's another way that you can get scholarly activity and get projects that you can actually align your passions, your interests, and the requirements for academic advancement. And then the other thing that you could do is, if you're interested in a topic, start looking it up, and off your own, it doesn't need to be an invited review. You can really look at the literature, scour the literature, and do a very detailed review. So for some reason, there was a lot going on in catheter lock solutions, and I was very interested in the different kinds and what the benefits were and what the disadvantages were of each kind. And so I went ahead and started writing reviews on catheter lock solutions. And as I got more proficient, not only was I invited to give talks, but I was asked to review other people's work. And based on a review that I did for NDT, the editor emailed me and asked me to write an editorial. So again, you expand on your you build on your body of work, you expand on it, and just make sure that every time your foundation is the key and it's strong. And one more way that you can actually increase your scholarly activity is to find amazing friends and collaborators. So I'm not sure if a lot of people know, but KidneyCon, when it first started, it really started off as Kidney Biopsy Academy. And Dr. Arthur and Vaughn and I were co-fellows at Emory, and Shri and Manisha, and we all got together and we put together this Kidney Biopsy Academy. And I remember the first time that we did it, we all were sitting in a room, hashing out what we are going to do, how we are going to put it together, how we'll run it through the workshops. And then somebody said, we should publish this. And so I remember all of us coming up literally at the scene with questions that we would ask, surveys that we would do of our respondents before and after doing the Kidney Biopsy Academy. And lo and behold, it was written up and it was a publication. So many, many different ways to take your interests. You don't have, and it doesn't always have to be a very high level original research. It can be whatever you're doing, because the more you write about it, the more everybody can get to share that knowledge and be able to incorporate anything they are interested in within their practices. Another point that I'd really like to make is broaden your horizons. So, I've been talking a lot about what we need to do and make sure it's your passion, make sure it's your interest. What about if you get invited or you get asked to do something that's really not your core passion or your interest? Well, I would still say give it your 100%. And so this is my story with gout. So I know as much, at least at that time, I knew as much about gout as any general nephrologist does, not a whole lot. I had some interest in uric acid and looking up the pathways, but I wouldn't say I was the expert. And I had this resident that I had worked with, and she called me one day out of the blue. I remember I was on vacation out of the country. Excuse me, in India, and she called me, sorry. And she called me and she was like, the gout guidelines are being written. They have an issue and they need a nephrologist. And I was like, I don't think that's my area of expertise. And she was like, no, they really need one. So I gave them the full disclaimer. I'm not the expert, but I can read up on it. And I did. And as I did, and as I read up on it, I got more and more interested. And this led to a thematic issue, me being an advisor, a consultant, and also led, now that I'm looking at CKD fix, Pearl, Feather, it's all the areas that I sort of walked through of quite a few years ago. This is 2012. And the other thing I would say is be persistent and don't give up. So this is actually a picture I took myself. I was on a walk and I saw this flower in the sidewalk, literally just blooming. And that, I think, is a lesson that all of us, whether we are in academia or private practice, have to learn and have to live our life through. So when I said I wanted to get on the CLABC committee, the one thing I noticed when I got there was not just the infections, but that a lot of our patients CKD patients in the hospital were getting PICC lines. And we know as a nephrologist, we don't really want them to get PICC lines for our patients because it jeopardizes their future accesses. So we had no policy at Emory at that time. And I decided that I felt very uncomfortable watching this and said, I really want to change the policy. And I talked to the CLABC committee and they said, well, if you can share again the data and share the information. It took me 4 years to get that policy approved. But now that policy is throughout Emory Healthcare. If anyone tries to order a PICC for a CKD patient with an EGFR of less than 45, the CPOE will automatically default and move them to a tunneled IJ, which has a much lower risk of central stenosis. So again, you can make a change, you can make a difference wherever you are. And always challenge the status quo. Because just because we've always done it a certain way doesn't mean you have to continue to do it that way. Question, be intellectually curious and see what it is that you can make a difference wherever you are. Because the one thing that I would say is if you see a problem, try to think of the solution before you bring up the problem with somebody else. Or ideally, you can brainstorm that as well, but it is better to see if you can come up with the solution yourself. So this is one thing that we did where, again, on the vascular access side, I was noticing that a lot of our patients, we all know that nationally, a lot of our patients start dialysis with a central venous catheter. And many times when you talk to them, you realize that they haven't been educated enough about their options and their possibilities. And so I was trying to figure out, is there a way that we can improve their education? We used to have education classes that were once a month, but for these patients to come to our center once a month was not very, it was not very easy. And so it was not very easy, and they were not getting the education that they needed. So what we decided at this point was that I would put together a video from patients, because it's very different when a physician is talking to the patients or nurses are telling them something, but actually have the patients that would come and that would be able to discuss it and bring it up. And so we made this video that is now used again throughout Emory Healthcare for our CKD, advanced CKD patients. And here what we did was that now we have it on YouTube and over 190,000 views so far in the last 2 years. The other thing that we did for our patients is that we noticed a huge amount of infiltrations within our dialysis unit. And we realized that it's the frontline staff, the dialysis tech and the dialysis technicians and the nurses who are cannulating these patients, but sometimes they don't have the experience, sometimes they don't have the tools. And we started this project where we trained them how to do this. And basically, when we did that, what we saw in these patients is that if we were able to train them, and I use these models that I made literally at home with Metamucil and gelatin and Penrose drains, and train them how to do these cannulation techniques. And once we did that, we realized that we were able to decrease. In fact, in the last 6 months, we've had only 1 infiltration in 700 plus dialysis patients. And now this kitchen project, as we say, we are being approached by so many people to be able to duplicate what we are doing at Emory Dialysis. So again, I would say, go ahead and challenge the status quo. If you see a problem, go ahead and try to fix it, and then you can go from there. And then the one thing that I would say is to stay intellectually curious. And on my Twitter bio, I've actually said, I'm still, I'm a lifelong learner. And throughout, whenever we have any faculty development course, I always take a look at it. Even if I can join for just an hour, if there's something that interests me, I'll try and make the time just to go across, attend an hour or 2 of something that pushes me towards advancement. But I will say that at the time when I became a full professor, I was sort of at a loss because wasn't quite sure what my purpose was, where I'm going next in life, and what I'm going to do. And serendipity, the advertisement for the NSMC internship came my way. And I think it was literally the day before the deadline. And I was sort of at this time where I was, sort of bereft, little, thinking about what, and I think that was probably the first time that I was being intentional in what I was going to do. And I said, I wrote an essay and I wrote exactly what I was thinking, that I needed to explore new territory. I'm not a techie person at all. I don't have Facebook, I don't have LinkedIn. And so, and I was very diffident about starting being on Twitter and doing all of that. So I did apply, and thanks to the NSMC internship, I graduated. And I learned a lot. So I really did learn. It wasn't just learning about social media or about FOMED, but also that community that you guys have created is amazing. And it provides so much of support and encouragement. And there's so much of learning going on. I mean, honestly, I gave the ACP talk for nephrology updates yesterday. And I will say that a lot of my discussion and my perspective was shaped by the discussions I had read on social media, mostly by the NSMC internship. And not only that, every one of the mentors there are just amazing, amazing people who are always looking to move nephrology forward, to move every individual forward. And I'm really glad to be a part of that collaborative community. And at the same time, I also applied for the Woodruff Leadership Academy. Well, I didn't apply, sorry. I was nominated and I was accepted into the Woodruff Leadership Academy. So went back to learning after a full professor. I came to be an intern for the NSMC and a fellow of the Woodruff Leadership Academy. So my suggestion is always continue the learning, because it exposes you to new fields, it exposes you to new people, and the more you grow, the more you evolve, and the better it is. And then coming towards this, I think this is the crux. Life throws curveballs, and you have to be able to deal with those curveballs as you move along life. And the ability to be able to be flexible, to adapt, and when you fall down, to get up and start walking again is the key. And if you're resilient, then you can keep moving forward. And I will say that when I first started my life, I thought I was going to be in India. This is what I was going to do for the rest of my life. And literally, when I was finishing up my residency, about to finished my dissertation, about to take my final exam, and I ended up meeting my husband. And my life completely changed because he was living in the US, and I knew I had to start from scratch and to really reinvent myself and start looking at things in a different way. And along the way, our family grew from 2 to 3 to 4, and then to 6 and to 8, because our parents moved in with us. So during the time while I was growing and learning, I was also taking care of a family household of 8 people. And I knew that many times, I would have to just go with the flow and adjust to everything that came. So my first foray as a fellow, as I mentioned to you, was doing my clinical research. And when I was doing research, the hypothesis that I had was that cool dialysate would decrease blood pressure in the long term. And we were looking at cytokines and endothelial function. And this was the research that Dr. Arthur mentioned earlier. When I finally analyzed my data after 2 years of doing this research, because I did do an extended fellowship to be able to do my research, this was a topic I still remember at NKF presenting my poster, and the luminaries in the field, like Richard Sherman, who was a luminary in temperature, and Peter Stenwinkel, who did endothelial function, IL-6, stopping by my poster, talking to me, trying to see where I was going to go next with this, and being profiled on the Renal and Urology News cover page for that research. I really thought I was going to. So I was writing K23s at the time, but there were some divisional issues. My primary mentor was someone outside the division. We were looking at adding additional mentors and things that, not for this forum, but for some reason we couldn't move the research forward. And so I had to shift gears. And interestingly, at that time, I was a month away from finishing my fellowship. I had decided research may or may not be my path, and I had some offers from private practice. And Dr. Sands, my division chief, asked me to go down to the Access Center for a month and to see. He asked me literally if I could check it out and tell people if this was something that we should incorporate within the fellowship, because we were not having our fellows do these procedures or actually even be exposed to vascular access. So I went there and absolutely loved interventional. So I started doing procedures. In my first week, I was doing angioplasties by myself. And then by the middle of the third week, I was actually doing uncomplicated thrombectomies by myself. So I came back all enthused and I said, this is amazing. All these 3 years, I never got this exposure. So I really do think that, this should be in every fellowship. Everyone should get exposed to vascular access. And I didn't know at that time, but they were evaluating me for a faculty position. So Dr. Sands offered me a golden deal. He said I could go ahead and try it for my first year as a faculty. If I liked it, I could stay on. But if I didn't, there would be no non-compete, which is a big deal in Atlanta. And so I was like, it doesn't hurt. I'll give it a year and let's see where it goes. And of course, I'm still here. So it was the best time of my academic life. I loved interventional. We were the game in town, and anyone from a 6-hour radius would literally drive and come here because they didn't want to get these procedures done in their outpatient. Anyone in the country that needed to get trained would come to us. I think there was a time at an ASDEN meeting where more than half of the people in the meeting were people that we had trained. And this really became my home away from home. We had this core group. Even when I was doing my procedures, all I had to do was put my hand out and my staff knew exactly what I needed next. So this was really, really an amazing time for me, but all good things come to an end. And a lot of other practices started seeing that this was lucrative, and people who were referring to us decided to open up their own access centers. And Emory did make, I think it was the right decision, a strategic decision. They were going to get trained somewhere, so why not we train them? And so we trained our own competition. And within a year, we went from, this is after 10 years, but within a year, we went from being the only game in town to 7 access centers in Metro Atlanta itself. And that was not conducive for us for financial viability, and our access center closed. And we spent a couple of years after that trying to look at cath labs, look at different locations, get hospital privileges, but it really didn't work out. And I'm going to share something that I have not shared in any other public forum, or in a lot of people don't know that, is that interventional was my life. And at that point, I was sure that if I couldn't do it at Emory, I was going to do it somewhere else. But life happens, and I had something that precluded me from doing any more radiation exposures. And I ended up requiring some stuff and surgeries. And I realized that that was not a path that I could follow anymore. And I think that, as they all say, you know, life is not a straight line. There are ups and downs, and sometimes more downs than you think. And I was at a loss at this point in my life, because I had, you know, I had gone through changes in life, some of them my choice, some of them not my choice, but they were things that I could do something about. And here, I had sort of envisioned a future for myself. I had envisioned, um, I really, you know, that instant gratification of those procedures, being able to make a difference, being able to just be knowledgeable about vascular access and getting more and more involved in it. Um, I those doors closed for me, and I really didn't know. I remember, I think that was a time where I quite a few weeks or months, I was not I was not myself, and I had a hard time accepting it. But you know, you've got to accept it. And once I got out of the despair and the slump of it, I had to figure out how to reinvent myself. And I realized that I actually had expertise in something related to vascular access. So I was already director of vascular access at Emory Nephrology, both not just for the procedures, but also for the outcomes. So I could continue that. But the other thing that I had expertise in, all of us, if you're an Emory fellow, are trained in ultrasound. And so I was trained in renal ultrasound. I had done a lot of ultrasound in dialysis access. And in fact, way back in 2010, before I even knew anything of this was going to happen, I gave the first talk on ultrasound in dialysis access at ASDEN. And Don Schoen, so you all know the Schoen catheters that we use in our VASCAT placements. That's Don Schoen. And he stood up after the talk and said, this was the best talk in ultrasound that he had heard. Now, ultrasound was just starting off at that time. And a few years later, you know, so when one door closes, others open. And all that expertise that I had gathered over the years, no experience, like I said, is wasted. Well, I was able to use it. I was able to start establishing myself as a leader in ultrasound, not just myself, but the society, ASDEN. We at ASDEN are now putting together criteria for ultrasound certification, not just in kidneys, which we've had, but also for dialysis access and for volume assessment. And being able to do that and put up a body of literature on ultrasound in the fields of nephrology, as for procedures, for simulation, for dialysis access, for volume assessment. And I was fortunate to be asked by AIUM to help write the guidelines for ultrasound for vascular access procedures. So again, I think the lesson for that for me was that even when you think that things are hopeless and that, you know, what are you going to do next? Everything you work towards is gone. Maybe not. Maybe, you know, there's another path. You just have to be patient and trust. And, you know, hopefully things will turn around. Be resilient and give it your best. And lastly, I'd just like to end with this, is that just be you. You have to be true to yourself. There's a lot of times I get asked from people as to whether, you know, you should be networking or you should be doing this. Now, I don't really fit into any category, right? I am an immigrant, someone who moved to this country midlife. I am a woman of color. I'm one of the first few women in interventional nephrology in a completely male-dominated field. And I think as long as you are true to yourself, I don't network. I never had the time to network because I was always trying to balance my two big loves, my profession, my career, and my family. And anytime I went for a conference, I would literally give my talk and come back because I had to come. I wanted to come back to my family, and nobody else. I think we are all very similar in many ways, but also unique. And so focus on your strengths, focus on your uniqueness, because you can chart your own course. March to the beat of your own drummer be whoever you are, but be true to who you are, because let your work speak for itself. You don't need to go out and promote it or do anything, because people will notice. And as you keep working and as you keep delivering, you will be noticed. And, when I look back through my life and I look at all the major what's considered achievements, I have a lot, and I've been blessed and grateful to have amazing mentors, amazing opportunities, amazing second, third, fourth chances in my life. And but if someone asks me what my definition of success is, it's for me, my family, and I don't feel I've really worked a day in my life. Yes, I put in many hours, but it doesn't feel like work. It feels like something that I just do because I want to and because I love to do it. And being able to watch my children grow up from the babies to teenagers, and so far teenagers, and watch them sort of, grow up, be with my husband, who's been my support, my strength, and my rock, and be able to take care of my parents. I think all of these things are just as important, if not more important to me than my professional achievements. And I've been very fortunate to be able to find that balance. And I can say that if there's something that I can do, I think anyone can do it. And so I just want to say thank you very much for listening to my life journey. I hope, it's the first time I've shared some personal episodes in my life. And I do hope that in some way or form that they have helped you. And maybe as you chart your own journey, you don't have to make the mistakes that I've made, and you can learn from my own experiences. Thank you so much for your time and attention.
Thank you so much, Vandana. That was incredibly inspiring, and thank you for sharing that. I think the point of the KidneyCon keynote is exactly to do what you just did and share your story and inspire us all. And I think I'm a little bit overwhelmed and blown away, and so we'll be thinking about this for the next few days. So we have some time for some questions. If anyone wants to share or even a comment, we're happy to unmute you, or can share in the chat. You're getting a lot of nice messages in the chat. Matt, did you want to say anything?
Well, yeah, first, thank you so much for that talk. And I know you've been waiting over a year to do this. But I mean, that's definitely the best talk I've ever seen. And I'm inspired to go and conquer the world. I think, you live that. Like, the fact that you did the internship for social media as a full professor, I hope that I can continue my career like that, where you never look at something like that and think that it's not for you. So it's an amazing story, the pivots you had to take. And I hope everyone on this call this Zoom will be inspired to be we need to have tons of, we can't have exactly, but tons of Vandana Nayers out there to make the world better.
Thank you. Thank you. It's, to me, to come here and to be giving this, but I was telling, I was so nervous, and it's hard to share your life. It's very easy when you are giving objective talks. It's very easy to sit there and dissect the literature and give your opinion on it. Very, very hard to find that balance and putting together the talk. So I'm so glad that you all liked it, and I hope that it helps in even if in a little way. So, and it's a great opportunity. So thank you.
And then I can't really add much to what everybody else has already said, but that was truly inspiring. Thank you so much.
Thank you. Thank you, Dr. Arthur. You're one of on my wall of mentors. So thank you.
All right. I think we are almost ready to end KidneyCon 2021. We are hoping to see everybody in person next year. John, did you want to say anything?
Yeah, so thanks for everybody staying with us for all this. I am really looking forward to seeing everybody next year at KidneyCon. All of the hopefully fantastic talks that we'll have and the opportunity to see people face to face. So I am going to head home shortly and fix myself a martini, and I'm going to think of all of you.
We'll miss
Fantastic.
that. We miss it.
All right,
Yeah.
so we're gonna Matt, you want to say
No,
something?
I was going to say, I had heard that you'd sent meatballs and martinis to everyone's house. That's
All
it.
right.
Wow. It's over.
All right, so we're gonna play some music. Thank you all again for staying with us. We really appreciate your support, and enjoy the rest of your weekend. See you soon.